I do want to talk about acupressure and acupuncture because I briefly mentioned to the Heal Squad that I found this acupuncturist through one of our guests, Rebecca Zamolo. She's a famous YouTuber, and she was like, "This guy changed my life." And I said, "You know, it's interesting. I've been looking for someone that does this. It's kind of hard to find nowadays because." I don't know. I feel like reflexology and acupuncture and acupressure, you don't really hear a lot about. You hear about a lot of energy work, but not about that. So I went and it was game changing. In one session, everything changed. And a
Yeah,
lot of the things I was telling him I was having issues with, he's like, well, that's because you don't have a spleen. That's because you don't have a spleen. And I was like, oh my God, I didn't realize how much the spleen and the lack of it has been contributing to issues. So I am really gung ho about it again because I told him, I said, listen, I've had it. I just have never had any kind of visible results that were inspiring to me to make
hmm,
me keep going. And now with him, he taught me the acupressure points to hit. So he literally looks at me and he's like, "Do your lips get really dry?" And I'm like, "Oh my God, yes." He goes, "Oh, just go right in here in between your hand and bring chi to your lips." And I'm looking at him and I'm like, please. And it happened like instantly. So now I'm doing those. I'm doing all the other ones. My legs after all the MRIs with the gadolinium and the PET scans, my legs turned into rocks. Like
really,
my calves, they were like rocks. And funny enough, my other friend who went through chemo, her legs have been like rocks. So I told him, and he was like, "Oh, and I think this was the point right here." Yeah. And so he was like, "Oh, just do this." And you find the spot that's tender and you just hold it for 30 seconds to a minute. Do it as much as you can throughout the day. He did it and they literally healed instantly. So then I sent my friend, I go, "You gotta go right now. You gotta go right now. Your life is about to change." And it healed her too. And so I find myself at my daughter's birthday party talking health at the end of the night by the fire pit. And I was like, "Is anybody here constipated?" And like everyone for like my little cousin to my older cousins were all like, "What? What's the solution?" I'm like, "Okay, so there are these little pressure points across your finger all the way here into here." And so
right?
well, those I learned on my own because once I got inspired, when I was in the DR healing, was just very focused only on health. I was like, wonder what those points are because that's been an issue.
Hmm.
And I realize now it's twofold. One, he told me to start drinking hot water before meals, middle of meals, and after meals. He said it would help. I said, well, I stopped water around meals a long time ago because I was told that it waters down the enzymes in your gut. So now I know why I've been constipated for a year because I stopped drinking water like an idiot. And so now things are moving again as I'm doing my points and drinking the hot water. So, clue, guys, make sure you drink hot water.
When you had the dry lips, one of the biggest things is that when you find people that have redness around the lips or dry lips, they always tell you always go for the spleen. Like when you said your legs got super hard, another thing too with your spleen, did you ever have any times like your shoulders hurt really bad or your elbows or anything like that, your upper back? Did you ever get sore back or no?
Yeah.
Yeah, those are usually those and spleen and chronic. Do you chronically worry a lot?
Oh my God, yes. It's my full-time job. I try, I'm better. I'm a lot better than I used to be.
Oh, I love it that you did the points though. Like when you say constipation, if you stop drinking water, usually with pancreas and spleen, I always tell that's the earth element. So when your earth element goes in, it feeds a lot of your metal element into your lungs and such. Do you ever have any problems with like weakness in your lungs or anything of that sort, or your large intestine? Any breathing issues?
I mean, I had breathing issues for a long time. I believe most of those healed when I did Dancing with the Stars. I think there was like a little gook that built up on them and then the slow buildup of cardio. Imagine you're putting one foot in front of the other, and then you're adding another step, and then you're dancing for 8 hours a day. By the time I was done with Dancing with the Stars, 14 weeks of that, I could breathe. It was gone.
Wow.
Yeah,
Cause you
no,
like you
no more inhalers, no more any issue. It was crazy. And I explained it to a friend and he goes, yeah, that makes a lot of sense, actually. So funny enough, I'll finish the birthday story. I'm showing them so much, all the constipation points, that when they left, I had to go to the bathroom again. And I'm like, well, I've only been going once a day. Now I went twice. And it's like hilarious how much it works. So, um, yeah, and then even like he taught me the divots back here in your head are really good for your brain, like for your eyes.
very much so. Randomized right back here. If you put your fingers right here, that's known as a gallbladder 20, and that will help your vision quite a bit. And if you do that point, you can actually go right where your neck meets your shoulder, and those are going to be your gallbladder 21s, and those will help your vision quite a bit. And you'll notice a big difference. Yeah.
It blows my mind that okay, another one I had I whether it's officially your SI joint or whatever, down my lower left back. Oh my, I couldn't stretch it enough, roll it out enough, ice it enough. It was just this thick spot of pain. And in one session, he healed it. And he's like, oh, if you ever need to do it again, it's just this spot back here. Find that one spot in your shoulder blade that hurts and hold it. And it really hurts. It's gone. And so
Love it.
if I had gone to the doctor, they would x-ray me, expose me to all this radiation.
Hmm.
Then they would maybe inject me with some cortisone. They give me some painkillers like some gabapentin or whatever. None of it that's going to work either. And that would be it because the system is trained in that method.
Hmm.
Go to someone like you. You're going to put a little acupuncture needle in, teach me how to do it and keep it going at home, and you're actually cured.
It's amazing when he identifies that area on your shoulder blade. I'm so thankful because you have kindred spirits because whenever you know somebody had an SI joint issue, and he knows right down that little triangle that you'll have areas that are referred to the bladder, small intestine, even colon, and he pinpoints it and says that's your SI joint point that's related to your small intestinal area, and he said rub that point out, and it opened up not only the chi to your small intestine, but it alleviated that part of your sacrum that's connected to that area. And people walking around with low back pain literally coming in and they say, doc, I have an L5S1, and yes, there's disc issues, but having them do this, Maria, like on their elbow at large intestine 11, because they're functionally constipated, you'll find that they have cold, and they will do that and they say, I just went to the bowel movement 3 times today, my back pain's gone.
It's
And
crazy.
it's amazing. He sounds like I mean, I gotta meet this doc. This is so great. I love
No,
this.
he's incredible. I mean, I guess the truth is, and what he was sharing with me is like it really depends on who you learn from. Like he
Yeah.
was a really great teacher. But
Hmm.
I'm actually thinking about this. It was funny. I was also talking about another episode. I love what I get to do with the show because I learn so much and I love learning. But we had a woman on the show, Dr. Sarah Reardon, and she was talking about pelvic floor issues.
Yeah. Yeah.
And there was like, sometimes I'm like, oh, it's this LA fad. People are getting their pelvic floors worked on. I'm like, I can barely go for my annual. I want to get in and out of there. I'm going to have someone massaging me down there for an hour. Heck no, not happening. But it begs the question, Dr. Motley, is there, because I asked everyone who pushes out their pee, and everyone raised their hand.
Yeah.
I go, guys,
Yeah.
we can't do that anymore. My dad has constipation issues. I think because he's probably pushed so hard. I think he's destroyed his pelvic floor as well. And the diabetes obviously doesn't help that issue as well. But I wonder, is there a point for your pelvic floor for all of us who are maybe dealing with that?
Definitely so. I wish I had my you could see my uh, charts here, but usually on the pelvic floor, you can go to your pubic bone, and the pubic bone, right, where you can feel the pubic bone. It's like right above your nether regions, and there's a few points on the inside,
Like
like
go down your belly button,
go down your belly button, and
right
you
to
can go
where you
down
feel a bone,
right till
right
you
where the
feel the
bone
bone right
starts.
above the main ear. Yeah, exactly. And when you find that little the pubic bone, if you go to the outer edges of the pubic bone, you're gonna find tender spots.
Yeah, I
If
found
you
a
go,
spot.
you find that you rub those points out, okay? Then I wish I
Rub or hold?
rub it
Both.
out.
Okay.
Okay.
Oh, it
It
hurts.
hurts. And then what you'll do is
I never
from
thought
this,
I'd be live touching my pelvic bone, but here I am.
I bring it out with the best of people. I'm telling you, like when you rub that point out, and even when you rub the point out, and the area gets massaged out, if you go around and you trace your finger, I'm sitting here doing it, not even giving good camera angle. If you put your fingers and you go to the outer hips, the hip bones on the sides as well, the side that's most tender, exactly right. Go a little bit out, a little bit more to the edge, right? Yeah, around there. Okay, dig in on those hips. Okay, if those feel okay, that's another point that you could do pelvic bone right there, but right on that pointy point of the bone,
So
okay?
your pelvic bone right here.
Yep, right there. And you rub those points out and on the sides there. And then if you have somebody you can reach out, like, around your sacrum or now your tailbone, you just go complete circle around and you rub right on the SI joints. You will open up the pelvic bowl. Now, another thing though too is that when you say, when who needs to force to pee? That's such a good point. And I get at him. I just take my glasses off when I get so into it. The bladder is one of the most prone infection holding containers. So whenever you do get functionally constipated, one of the things I always say, when you rub the pubic bone, right, and you rub the side, you have to start to massage the bladder points. And sometimes one of the biggest areas is your calf muscles. If your calf muscles get super tight, or your heels,
Yeah.
like plantar fascia, rub around your ankles and such, you'll start peeing out more. Anybody that has cracked heels, the little bumps on their heels,
Yeah.
do you have that? Those things always happen
My
when you get
heels right now are so cracked.
bladder. You got bladder
And
infection.
and you know what's interesting? So wait, that means you have a bladder infection?
Yeah, you have a hidden bladder infection. Yeah.
Hey, Heal Squad. We have been on quite the journey together, and we're hearing from so many of you just how much this show is helping you heal and get better, and it makes us feel so good. We love, love, love it, and we just ask that you don't keep it to yourself. Spread the message and share the show or your favorite episode with your friends. And if you want to help us even more, you can leave us a 5-star rating and a comment on Apple Podcasts or Spotify, and follow us on Instagram at Heal Squad. You can also DM us anytime because we love connecting with you. And finally, you can also join us on Patreon for our monthly live heal events with world-class healers and ad-free episodes exclusive only to Patreon and our Super Heal Squad for as little as $10 a month. So go to patreon.com/Heal Squad to join. Getting better isn't easy, friends, but as I say all the time, it's a whole lot easier if we can do it together. We love you all so much, and we love doing this thing called life with you.
This podcast and all related content published or distributed by or on behalf of Maria Menounos or MariaMenounos.com is for informational purposes only and may include information that is general in nature and that is not specific to you. Any information or opinions expressed or contained herein are not intended to serve as or replace medical advice, nor to diagnose, prescribe, or treat any disease, condition, illness, or injury, and you should consult the healthcare professional of your choice regarding all matters concerning your health, including before beginning any exercise, weight loss, or healthcare program. If you have or suspect you may have a healthcare emergency, please contact a qualified healthcare professional for treatment. Any information or opinions provided by a guest expert or host featured within website or on company's podcast are their own, not those of Maria Menounos or the company. Accordingly, Maria Menounos and the company cannot be responsible for any results or consequences or actions you may take based on information or opinions.